Disclaimer. This video content is AI generated as educational purposes only and is not a substitute for professional medical advice, diagnosis or treatment. Your health concerns may be unique. Always consult your physician or a qualified healthcare provider for personalized guidance.
So, quick question for you. When was the last time you actually thought about your tetanus shot? For most of us, it was probably a while ago. Today, we're going to get into why that little booster shot you might have forgotten, the TD vac, is so incredibly important for every single adult. All right, let's just tackle a huge misconception right out of the gate. So many of us think of vaccines as a kid thing, right? You get your shots when you're little, and then you're set for life. Well, what if I told you that's actually a pretty dangerous way to think? Because the truth is, that protection you got as a kid, it really doesn't last forever.
I absolutely love this analogy. It just makes so much sense. Think about it this way. A booster shot is basically a software update for your immune system's security. Over time, its old virus definitions get outdated. The booster is that critical update that makes sure your body is 100% ready to fight off those old enemies. Okay, so that leads us to our first big topic. Why on earth do adults need to keep getting these boosters anyway? It all boils down to one simple fact. That amazing immunity you built up against diseases like tetanus and diphtheria when you were a kid, well, it fades. Over the years, that shield of protection just starts to wear down, leaving you more vulnerable than you think as an adult. Let's break down exactly why this is so crucial. First, like we said, the immunity just wears off. Second, we are still seeing diphtheria outbreaks, and a big reason for that is low immunity among adults who haven't had a booster. But honestly, this last point about tetanus is the real shocker. Even if you get tetanus and somehow survive it, your body builds zero natural immunity. The only way to be protected is through the vaccine. That's it. So what exactly are we protecting ourselves from here? Let's take a closer look at the two very different and very serious diseases that this one shot prevents. So on one side, you've got tetanus. This is caused by bacteria that literally live in the soil, just waiting for an opportunity to get into a cut. Now, it's not contagious person to person, but the toxin it produces is terrifying. It attacks your nervous system, causing that infamous lockjaw and incredibly painful muscle spasms through your whole body. Then you have diphtheria. This one is super contagious. It spreads through a simple cough or sneeze. Its toxin creates this thick, gray coating in the back of your throat that can literally block your airway, all while damaging your heart and nerves. Yeah, two really nasty diseases and just one powerful shot to prevent them. Okay, I know this is where it can get a little confusing with all the different letters and vaccine names floating around. So let's quickly clear up the difference between TD, TT, and Tdap. It's actually pretty simple. Let's just break this down. So TD, that's the old school one. It only protects against tetanus. Tdap, on the other hand, adds protection for pertussis. You might know it as whooping cough, and that's mostly for teenagers and for use during pregnancy. The one we are really focusing on today is right there in the middle, TD, also called TD vac. This is the new gold standard, the preferred booster for adults, and it gives you that essential protection against both tetanus and diphtheria. To put it simply, Tdap is the new standard because the protection is just so much broader. It directly tackles that problem of fading diphtheria immunity in the adult population, which makes it a way more effective public health tool than the old TT vaccine ever was. All right, so you know why you need it, and you know which one to get. Now let's talk about the most practical part. When are you supposed to get it? Let's get into the schedule. Look, if you remember only one number from this entire breakdown, please make it this one, 10. For most adults who got their vaccines as kids, the recommended schedule is just one booster shot every 10 years. That's it. It is that simple. But what if you were never vaccinated, or maybe you're just not sure about your vaccination history? No problem. In that case, you'll need what's called a primary series of 3 doses to get fully protected. The schedule is straightforward. You get your first shot, then the second one a month later, and then the final dose 6 months after that first one. Now, outside of that routine schedule, there are some other really important times to get a TD shot. Adolescents usually get boosters around ages 10 and 16. It's also a critical part of wound management, if you get a deep or dirty cut. And of course, it's highly recommended for healthcare workers, some travelers, and it can even be used during pregnancy if the preferred Tdap vaccine isn't around. And finally, let's talk about what's probably on your mind right now, safety.
What can you expect after the shot? And are there any reasons you just shouldn't get it? So, the good news is that TDVAC is considered very, very safe. The vast majority of side effects are mild and temporary. Pretty much exactly what you'd expect. Things like a sore arm where you got the shot, maybe a slight fever, a headache, or just feeling a little tired or achy for a day or so. The reasons to not get the vaccine are actually very specific and quite rare. The main one is if you've had a severe allergic reaction, called anaphylaxis, to a previous dose. The other big one is if you're currently really sick with a high fever. And even then, it's not a no, it's just a wait. You just postpone the shot until you're feeling better. And it is so important to remember this. Having a simple cold is not a reason to delay your vaccine.
Here's a really simple way to think about how these vaccines are handled. Just think of it like fresh milk. For it to stay effective and do its job, it has to be kept properly refrigerated, somewhere between 2 and 8 degrees Celsius.
And this part is absolutely critical. You cannot freeze it. Freezing the vaccine completely destroys its potency. It renders it totally useless. And that brings us right back to where we started, with that simple but really powerful analogy. After everything we've talked about today, just take a second and ask yourself a simple question. Is your immune system software fully up to date? Thanks for tuning in.